I'm pleased to be joined today on Health Beat by Dr. Eric Rome, heart failure specialist with Faith Regional Cardiovascular Institute. And we're talking about remote monitoring of heart failure patients. So doctor, tell us about the technology that you use to remotely monitor the statuses of heart failure patients.
First, before I'd like to talk about remote monitoring, I'd like to talk about the importance of remote monitoring.
Sure.
Okay, remote monitoring has been around, or the attempts to monitor patients from home has been around for over 20 years. And the importance is about admissions for heart failure. As we talked about the importance of admissions for heart failure, it's a costly item, and it's also associated with dying from heart failure. Patients that are admitted for heart failure are more likely to be admitted in the same month. So if you're admitted for heart failure, you have a 25% chance of being readmitted in the same month. And you're likely to be readmitted in the same 6 months, about another 50% chance.
I see.
And those patients are likely to die within the same 3 years from their heart failure. So if you're sick from heart failure, you're likely to be sick within the next 3 years. And that's a thing that we take very seriously. So even with the best clinic serial monitoring using blood pressures, we've failed to get a good idea of when to predict when patients are going to get sick from their heart failure. So looking at this graph, all the way to the right here is what we call decompensation. This is when a patient is highly symptomatic from their heart failure, where the pressures have risen to the point where they feel short of breath, they have excess fluid inside their heart, where they become very short of breath, they have usually edema, their weight has risen. This is the point at which it's too late. They come to the emergency room, they have to receive diuretic therapy, they usually are admitted for their heart failure. If you look and go back in time 10 to 20 days, you see the pressures have already started to rise. Usually there's some event that has happened prior to this that we honestly, a lot of times we can figure it out, but regardless, there might be something that we could have intervened on then. Before, we didn't have any technology that can do this. Okay, we've attempted with certain devices, but now we have a new piece of technology that can actually see these pressures at all times that we can monitor from our clinic, that we can possibly make either dietary changes, recommend changes in medications, or arrange even a face-to-face visit with our patient to say, what is going on, how do you feel, and make some type of changes that possibly can intervene to avoid a hospitalization for heart failure. And that's the importance of the design of this device and the importance of avoiding readmissions for heart failure.
We are very fortunate to have this advanced technology and program in Northeast Nebraska. And that's Health Beat, brought to you today by Faith Regional Physician Services.